Hello, Dr. Christina Grupcheva. I'm very pleased to have this talk with you. We are in the Emirati Society of Ophthalmologists, and each year they bring famous ophthalmologists to talk about not just ophthalmology, but various matters in life. So first of all, I would love you to introduce yourself and talk to us. Who is Dr. Christina?
Thank you very much. First of all, I would like to thank the Society for inviting me. It's actually not my first time in Abu Dhabi. I've been here to the World Congress of Ophthalmology many years ago as well. I'm an ophthalmologist from Bulgaria, and I've been working 32 years professionally in the field of ophthalmology. And 5-6 years before, as a student, I had extreme interest in this specialty, and even published and even was working as a volunteer. So basically, this is almost all my life dedicated to ophthalmology.
Yes.
So for me, this is not only profession, this is also hobby, this is my free time, this is my emotions. And
Your passion.
This is my passion, yes.
Amazing. And when you're passionate about something, it makes you shine in it. Do you agree with this, or is it just hard work?
No, it makes you happy, and nothing is hard when you are happy. So basically, everything I do makes me really happy, and this is most important. That's why I'm so happy about my profession. And every one of my youngsters, when they ask me, because I educated so many people in my life, when they ask me, would you do something different, I always say no, and this is real no, because if I need to start from the scratch, I will do ophthalmology again.
Were you influenced while choosing ophthalmology? Your parents, one of your parents were ophthalmologists, and seeing them do ophthalmology made you want to do it, or it has nothing to do with them?
It has absolutely nothing to do with my parents. Nobody in my family is a doctor.
Okay.
I decided to be a doctor at the age of 5 because I saved a cat.
Oh.
And I decided
Not a cat's eye, a cat.
A cat. And I decided that I'm going to be a doctor. Then at the age of 12, I started to wear glasses, and I was very much interested into eye health, but it was not before my 18th year when I was sent to ophthalmology hospital to do my attachment when I was a first-year medical student. And then that was definite that I'm going to be ophthalmologist. And I followed this dream for 6 years. And I was the first one from my class to be admitted into specialization in ophthalmology.
Okay, superb. Why did you choose cornea?
Well, it's an interesting question. Actually, when you finish ophthalmology, you have to make some choices. In my case, the choices were made by New Zealand. Because I had to do something subspecialized, and then I met my mentor, Charles McGee, who was at this stage in Scotland. And Charles told me, if you want to do cornea, you cannot do it here because I'm moving. So please come with us and join the team in New Zealand. So I spent 3+ years in New Zealand.
That's what we call passion.
Yeah.
You follow your dreams to New Zealand.
Actually, it's the end of the world. You must know that I had absolutely no idea what I'm doing at this stage. Now, when I think about this, that was my biggest step ever in my life, because he told me mid-December that on 30th of January 2000, I will have a position in New Zealand. I had to reorganize everything, and I went to New Zealand, believe me or not,
No, I
with
believe you.
20 kilograms of luggage, knowing that I must stay there for 3 years. And after that, a part of the family moved, another part of the family moved. I mean, my son moved, then my husband came.
I was going to ask you, how did you manage?
In a year, we were here and there, and then we gathered together, and we spent 2+ years together there. It was really nice time. And actually, New Zealand period was my biggest step, because I did research, because it was a research fellowship sponsored by Maurice and Phyllis Peichel. And also I did a corneal fellowship. So Charles was in charge to teach me do complicated corneal surgery. And after that, I had to introduce everything in Bulgaria, including amniotic membrane, because in Bulgaria at that stage, amniotic membrane was not known at all, and all the techniques about corneal surgery, because only penetrating keratoplasty was used in the country. So when I returned fully in 2005 in Bulgaria, I had a really tough time because I had to work with the authorities, plus I had to do my medical job.
Okay. So you moved to another country to follow your dream. And that is actually something that you must feel lucky, because not all women have the support of their system, their family and their husbands, and to follow their dreams. A woman's place is, in many countries, family first, raise your children, and then be the surgeon and be whatever you like. And being a surgeon, I think, as a female is not an easy thing. It's still not in 2025. And many women feel that they are the first students in the faculties. They are brilliant, but once they're in the market of being a surgeon, it's like men are mostly known than women. Do you feel that even in Bulgaria, as we were going to lean more about to men doing and following their dreams of surgery, but women should think twice before doing it? And did you have this difficulty while doing it, or did you have a support system that was strong enough to be like, we follow you?
Well, you probably know that Bulgaria is on the Balkans, and traditions there are very, very different than the Central Europe. And that was about 20 plus years ago. So I was extremely lucky because my late husband was the only person from the entire family that was supporting me. So basically, all his parents, my parents, everybody was against. Everybody was like, this is crazy, she should not go, this is the end of the world. It is really the end of the world, by the way. And nobody really was supporting me. But my husband did. And
so girls, you should marry a husband who supports you till New Zealand.
I think that the part of the game was that he was an ophthalmologist as well.
Do you think we should marry doctors between?
I think that it's very important that a female doctor that wants a good career to marry a doctor, because it's very difficult for somebody with different profession
to understand.
To understand, because I can give an example for myself. 10 years after my husband died, I have a new partner now who is not a doctor. And he does not understand me. Of course, now I have a career and I don't care because he's not my husband, he's my partner. But he always makes remarks that I'm working late hours, I'm picking up the phone, it's a patient while you're picking up your phone on Sundays, and things like this. And doctor will understand this, and non-doctor will take it as a burden. And this is not because we have bad relationship, don't take me wrong, we have fantastic relationship. Just this is something that the mind of an ordinary person, of a technical person, for example, cannot understand, because this concept is absolutely, truly not into their world.
Yeah, I totally agree with you, and actually sometimes it's one case to another. You can find an admirer of the doctor you are and be like a supporter. That it's not 80% of the cases, of course, it's 10% or 20%. But you either are lucky to find someone who's going to support you and go on with your dreams, or so many women that I know in ophthalmology are just brilliant, but because they feel like the responsibility of a family is way more, not impacting, but it's way more important for their entourage, that they hold themselves into shining and letting themselves actually be something great. And that is a choice that any woman should do on her own, whether it's family first or career first or both, and I can handle it. But I think you you must inspire your children after seeing what you have been doing to get your career, and it makes them have this super mom. So it's another satisfaction. I don't know if you agree with me.
Well, I have only one child.
Okay.
He's an ophthalmologist, by the way.
So he was influenced.
So he was very influenced not only by me. My son is a very interesting person. He said, "I'm not going to be a doctor because I see that this is not a good profession." Then in the very last year before he could apply, he decided to be a doctor. Then he was not an ophthalmologist until the 4th grade. And 4th grade, he said, "I'm going to be ophthalmologist after my grandfather and my father," which is actually true because he has a family who really were ophthalmologists. I'm just the one that came to this family. But recently, we are talking more open with him, and he actually told me that I was very, very huge influence for his decisions. So obviously, it is important that you follow your dreams. And I think that this is the most important thing. Yes, you may need to make some sacrifices. And this I tell to my young girls that I'm teaching, young girls around me, because they don't always have a support.
Of course.
And if they follow their dreams, they usually win. One way or another. Sometimes it's more difficult, but they usually win. So I think that this is probably the most important thing, to know what you want.
Yes.
And to follow
To
it.
follow it. I totally agree with you. And you're a cornea specialty, and I believe that you treat a lot of keratoconus throughout the year. So I'm going to have 2 questions for you regarding keratoconus. Are you from the school, rubbing is the keratoconus #1, no rubbing, no conus? Or are you from the school, there's way more to it than just the rubbing or the mechanical thing?
Oh, well, this is a tricky question, and I can answer to the first question that the only published proven case in the literature is from the last century, from Auerbach, who actually published a case where a boy was rubbing his left eye in order to regulate his heartbeat. They operated this eye and they closed it so he could not rub. And he had problems with the heart and started to rub his right eye and developed keratoconus there.
Incroyable.
So this is the only publication that I can refer to. Usually there is no significance in rubbing in the publications. However, I must say that I recognize keratoconic patients from the waiting room. Nobody needs to show me even the diffraction when I decide that this patient may be keratoconic. They usually have very loose eyelids, a very typical position of the eyelids as well, and they usually rub even in the waiting room. So rubbing has its role. Maybe it's not the main etiological factor, but definitely it has its role. If we prevent rubbing, I'm not sure that we are preventing keratoconus though, because they continue rubbing, and if we do cross-linking, we stop the progression. So I think that it's just one of the factors.
One of the factors, okay. And my second question is more about the future. You're a cornea specialist, and now we see the artificial cornea. How does it make you feel about the future of cornea and the patients with so many problems of cornea who sees this as a, the future?
Well, I believe in cornea, which is like an organ synthesized from your own cells. So basically, I believe in artificial cornea, which is not really artificial cornea, but it's a biological product, a result of engineering. So I believe more into tissue engineering. Artificial corneas, whatever products are on the market or were on the market, they always have the disadvantage because it's a watershed area. And because of this, there is a high risk of inflammation and high risk of extrusion. And this is the main problem with all really artificial products. So if we achieve the stage where we can synthesize the collagen, put the keratocytes in there, so a collagen matrix, keratocytes inside, and something which mimics the Bowman layer and Descemet membrane, then we easily can put the endothelium and epithelium, because this we synthesize in laboratory already, no problem. So I think that cornea is a very good candidate to be a biological product. And I definitely believe that this is the way to go. How we are going to fix it, I can imagine with glue, but nobody knows. Maybe we have another means, or maybe we just inject something which produces collagen, and then our own keratocytes populate it. And then I'm really dreaming about endothelial injection into the anterior chamber instead of DMAC. So for keratoconus, it sounds easy because you just need to inject in the stroma. So I believe in this. I don't think that there will be something like intraocular lens that we are going to exchange the anterior segment, put this thing, and patient is happy forever. I more believe in bioengineering.
Yeah, and we see that what is great about the cornea is the advances that we've seen in the last 10, 15 years. It's going so fast. And that is why I think in the next 10 years, it's not going to be the same. So many things are going to change in the cornea. And that is a great hope for patients that we see now. And we're like, there is no really solution unless it's a drastic solution of. But my second question, which is also about the keratoconus, the keratoconus patients, is, for example, in Bulgaria, how is the rate of organ donation or cornea donation? How is it in your country? Do you have this culture of cornea because it is one of the most, wanted organs? Does Bulgarian people give away? Is it systematically, or do you have consent, or how is it in your country?
It's a question of regulations, first of all, and the regulations in Bulgaria are not very good because you need to consent when you are alive.
Yeah, it's like in Morocco, actually.
If you are not consenting, you put a special stamp. But if you consent with your driver's license, then your relatives must decide. So basically, it's a post-mortem decision from the relatives. And in Bulgaria, we have a saying that somebody died with open eyes, which basically means that he died unsatisfied. And people do not like to donate the cornea because they are thinking that you are taking something from the eyes and then they can die with open eyes. So that's why we're making so many campaigns.
Okay.
Even last summer, I did a marathon and I was running myself in order to persuade people that this is a good thing, that donating a piece of the eye is actually something that is going to live and give sight to somebody else.
We actually have the same issue in Morocco. I'm from Morocco, and over there you can sign that, for example, for myself, I signed that I want to be an organ donor. But if I die tomorrow, it's my family who's going to decide if they want or not. So there's, even there, we try to, some people don't want to give away their organs, not because they're going to die with open eyes, but it's more of a cultural and a religious thing that is not really, we don't know if it's permitted or not. So we're trying also there to make campaigns and say, this is a great deed that you're going to do even if you're dead. So it is amazing that you're going to give life and the view and to someone else. And it's very important to do this, I think, and talk to the patients throughout social media and have a very precise and very easy way of persuading the patient that you're going to actually save views and lives, and that is something amazing to do it. And I think it should be done worldwide, which is gonna make people give more corneas.
May just make a continuation of what you said. Basically, I think that people that are having sight is taking it for granted.
Yes.
And they do not understand what really the sight means.
Yes.
And when they lose it, they
That's
already
where,
understand, but this is too late for some people. And I have lots of patients that changed lots of habits and lots of things because they had, for example, angle closure glaucoma with the bilateral loss of vision, and now they have good vision again.
Yes.
And this changed their life.
Yes.
So I think that it's maybe the ophthalmology fault as well, and
Even
we
us.
as doctors, because we do not make enough advertisement of how important vision is.
Vision is. Even as doctors, we should be more grateful actually after seeing what can be done to the eyes and the loss of sight. And sometimes we just take it for granted, like it's normal. We see retinal detachment and we see so many things that take away this great gift. And I feel like we're not sometimes grateful enough. So do you have a routine of gratefulness and to be grateful for what has been given to you after everything you're seeing every day?
Yes. For example, very often my patients are asking me why I'm wearing glasses. And lots of eye surgeons who are wearing glasses are saying stupidities like, oh, there is no surgeon that I can trust, blah, blah. Actually, I have lots of surgeons that I can trust because I did teach them myself. But the reason why I wear glasses is because I cannot take risks. And taking risk is a fact when you take an eye surgery. So this is what I say to every patient of mine. I can promise you the best surgery I can. I cannot promise you a risk-free surgery because me and you are taking risk in this journey. My function is going to prevent it. Your function is going to follow what I say in order to prevent it. But risk-free surgery is oxymoron. It does not exist because you always take a risk. It's a small risk, but you have to take it.
I'm actually the contrary because I did PRK on myself. But I trusted the doctor enough to do it. And I was this myopic kid who just wanted to get rid of her glasses so much. I couldn't. So at 28, I took upon it and I did the LASIK. And I hope I don't get any side effects later or something like this. But it changed my life. It didn't only change my view, and I'm so grateful for it. And I think I took a risk. Of course, I took a risk. But I think having a perfect vision is something you want to taste. And so I understand both of the sides, or the very careful sides who are like, oh, I was given healthy eyes, why should I touch it? And I should keep my glasses. And we have so many advances in technologies. And if the patient, you want to do it to the patients, why not just do it to yourself to prove that I would do it to myself, so I could do it to you. It's a gauge of trust, actually, with the patient when he sees you without the glasses. It's like if she did it on herself, so I can let her do it on me. But this is not the reason why I did it. That is so not. I was an intern. It was because I wanted to get rid of my glasses. But I understand both of the visions, totally understand both of the visions. And I think after 30 years of cornea, you're like, I just want my 15 microns cornea, not touching it, and let me out of any risks, right?
Well, I of course agree with you because they're the two sides of the medal.
Two sides.
But again, when I talk honestly with my patients and explain to them that because I love my profession so much that I would not take a 0.01 risk, not 2% risk. And this is not that I do not trust the surgeon. I do not trust my body, because my body may react to the operation. So basically, most of the time is the body that reacts to something. So that's why I cannot take the risk. But of course, I did lots of experiments. I put progressive glasses at the age of 32 without any need. I also wear contact lenses. I change different contact lenses. I try all contact lenses
To know what the patient...
to know how the patient feels. I do things that are innocuous and safe in a
Yes.
way, but my hands and my eyes are my most treasure.
Of
So
course,
I
of
cannot
course.
take any risks.
Yeah.
I stopped riding because of the hands. And because I want to preserve my hands
Yeah,
for
it's
surgery.
very...
So I did lots of personal sacrifices, and one of those sacrifices is to wear my glasses and explain to my patients.
Okay. Well, it was. I want you to have a last message for all the young ophthalmologists, especially female, who are following or who's gonna see this video. After 13 years and being in the field, and a woman, and a surgeon, and all the concessions, what do you have as a advice?
Well, I can conclude with Jay Kretschmer's quote, which is basically enjoy examining the eye. It's a privilege. And I can continue, follow your dreams, examine the eye, treat the eye, and this is really a life, and make it best life because you have only one.
Oh, I love it. Thank you very much for being with us and opening up and having this great conversation. It was really nice talking to you.
Thank you. Thank you again for the invitation, and I hope that it was interesting for the audience.
Very, very, I can say it was interesting, right?